Okay, so my name is Zoe. I am a BSN student at Troy University, and I'm going to perform a head to toe assessment on you. Is that okay?
Yes.
Okay, so before we start, I've already washed my hands. Um, at first, I'm going to assess just your general looks.
Okay.
You appear happy. You are appropriate for your age. You are dressed appropriately. Obviously clean. You have makeup on. You, I mean, I don't. Your hygiene is obviously good. Like I said, clean. You know, your hair appears clean. You have makeup on. So at first, I'm gonna look at your skin color. So it's pink. You're pretty tan. Warm. It's not dry. I'm gonna look at your nails. There's no clubbing. I don't see any. They're smooth. Your nail beds are smooth. Okay. Before you walked in, or as you walked in, your gait appeared normal. You walked in with no complications. You did not use any type of assistive device. Let's see. Before we started, I took all of your vital signs. All of your vitals were normal. Your BMI is okay. Slightly overweight, but pretty normal.
Thank you.
See. Okay. Do you wear contacts?
Yes.
Or glasses? Contacts.
Yes.
Okay. So for this, I do not have a Snellen chart. However,
okay.
If I did, I would get about, depending on the size, 6 foot for a small, 20 foot away from you, with a standard size. You would cover one eye. Let's just say your right eye first, and I would get you to read the smallest line that you could.
Okay.
We would do that for the left eye. Cover your right, do the left, then cover your left, do the right.
Okay.
And then we would do both eyes. And like I said, for this purpose, I do not have access to that. So that is what we would do.
Okay.
Let's see, we already did. I checked your skin. I looked at your nails. Again, I will, say again, your skin is dry, not scaly. There's no bruises. Your nail beds are pink, smooth. You don't have any ridges. There are no clubbing of your fingernails. So, I'm going to move on to your head and your face.
Okay.
So at first I'm going to look at your head.
Okay.
Make sure your hair is soft, it's clean, no breaking. Let's see. And then I'm going to palpate your scalp just to make sure that there are no lumps. Okay. So you have, there's no lumps, no lesions. Your hair distribution is is correctly distributed. I don't see any signs of baldness. Thank goodness.
Yes.
Your cranium is normocephalic. No abnormalities at all. So I'm going to examine your face. I'm looking at your eyebrows, your eyelashes, your nose. Everything about your face. Everything appears to be symmetric. Again, which is good. So I'm gonna test your cranial nerve 7.
Okay.
So what I want you to do, I want you to smile. Okay. Puff your cheeks and frown. Okay. Good job. And let's see. I'm going to check to make sure that you do not have TMJ. You don't have any pain while you eat or anything like that.
No.
Okay. Can you open your mouth? Okay. I don't feel any crepitus. No tenderness, correct?
Correct.
Okay. and I'm gonna palpate your sinuses.
Okay.
Your frontal and your maxillary. Or is there any pain?
No.
Okay, so no tenderness. Okay, so we're gonna move on to your eyes. I'm gonna check cranial nerve 2.
Okay.
And that is, I just want to see your field of view. Okay. So I want you to cover your right eye and tell me if you can see my hand. You know, make sure that you can see it. You can see it. See it. Cover here.
Yes.
See it. Okay. Cover your other. Do this.
Yes. Yes. Yes.
Okay. Let's see. As I am looking at your eyes, you have no lid lag, no swelling of your eyes. There is no obvious discharge. I'm gonna look at your sclera. Okay. Which is white. Your conjunctiva is clear. Your corneas seem I don't see any opacities. They're not cloudy.
Good.
Let's see. I'm going to cut the light off for just a second. Get just a little dark in here. And I actually don't have an ophthalmoscope,
Okay.
which I would normally use to look at your eyes. However, I would shine the light, for lack of better terms, into your eye to make sure your pupils are reactive. So they were reactive from, when I did turn the light off. So that's good. I would look inside of your eye. Your discs should be flat, with sharp margins. The vessel there should be no signs of hemorrhage. Your iris, obviously, the color is even. So I'm going to turn this light back on. And we're going to move on to your ears.
Okay.
Okay. So at first, I'm just going to look and make sure that they are symmetrical. And they are. I'm going to look. Is there any tenderness on your tragus? Okay. For this purpose, I would typically use an otoscope and look into your ears. You said that you did have some pain in your left ear.
Yes.
Correct? Okay. So I'll look in your right, figuratively, and I'll look in your left. Okay. So for your right, okay, there's no fluid. There are no signs of perforation.
Okay.
Good. It is pearly with, like I said, no fluid, no perforation. Okay. So then I would look in your left, and this one appears to have some fluid, cloudy fluid. It's bulging, red and bulging. So you probably do have an ear infection in that ear. Okay. Okay, so we've made sure, like I said, there were no tenderness. I'm going to check cranial nerve 8 and make sure that you can hear. So from here, I'm going to say a letter, and I want to make sure that you can hear me. Okay.
Okay. W.
Okay, and I'm going to do this one.
Z.
Okay.
Okay.
Good job. Okay, so we're going to move to your nose. I'm just going to look at your nose to begin with. It is symmetric. There are no deformities. Again, I would, if I had the equipment, look inside of your nose. Your nose should be moist. There should be no perforations in your septum. Your septum should be midline. Your nose also should be midline to your face. Let's see. Okay. Now your mouth. We'll look at your lips. Your lips appear, they're pink, not dry. You have no lesions, no cold sores. Can you smile for me? Okay. Your teeth are white. They're clean. Your gums appear to be pink. Again, for this purpose, your hard palate would be white, with some rouge, you know. Your soft palate would be little pink. I will ask you to open your mouth as if I was looking with the light, okay? Your tongue is midline, no tremors. Let's see, you have your buccal mucosa is pink, no ulcers. Your tonsils are 1 plus. When I'm gonna get you to open your mouth again and say ah.
Okay.
Okay.
Uh,
Okay. Good job. Again, for this purpose, I would normally check your gag reflex.
Okay.
Have you had any, like when you brush your teeth, does
No.
that, do you have a gag reflex?
Yes.
Okay. Okay, so we'll move on, go down a little bit more.
Okay.
I'm gonna look at your neck.
Okay.
Make sure that, okay, you have no bruises, no, palpate, or no lumps. Okay, your thyroid does not appear to have a goiter. Your trachea is midline. I want you to, I'm going to check cranial nerve 6. I'm sorry.
Okay.
I want you to, can you push against my hand?
Mm-hmm.
Okay. Can you push against my hand?
Mm-hmm.
Okay. Turn your neck to the right and left. Okay. Up and down. Okay. So you have full range of motion of your neck. So for this, I'm going to check your thyroid again. Okay. So for this purpose, can you stand?
Mm-hmm.
Just for a second. And I'm going to ask you to swallow. Okay. And you can have a seat. All right. So next, I'm going to look at your chest. I want to make sure that your AP ratio is less than your transverse. So which would be this, and it should be, your AP should be less than your transverse,
Mm-hmm.
and it is.
Okay.
So you are symmetric. If you did have a gown on, I would, look, your skin should be warm, dry, dry, no cyanosis. All right, I'm going to get you to stand and turn.
Okay.
I'm going to look at your shoulders. Okay, they are symmetric bilaterally. I'm going to check the expansion, okay? So I want you to take a deep breath. Okay, let it out. That is symmetric. I'm also going to check your tactile firmness. So I want you to say 99 for me.
99.
Okay?
99.
Okay?
99.
Okay?
99.
Okay, good job. And there are, I would note that there are no lumps. There's no tenderness, correct?
No.
Anywhere?
Mm-mm.
Okay. Now I'm going to percuss on your back, okay? I just want to make sure that there is no dullness. So. Okay. Let's see, before I get you to, I'm going to listen to your lung sounds, okay? Take a deep breath. Okay. Take a deep breath. Deep breath, let it out. 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 Okay, very good. So your lung sounds were clear. Bilaterally, there were no wheezing, or there wasn't any crackles. There was also no wheezing.
Okay.
So that's very good. So I'm going to go ahead and let you have a seat again.
Okay.
So, I would again assess the front of your chest, making sure your skin was warm, dry, that there was no cyanosis.
Okay.
Again, we will check the tactile firmness. Also, if there's any tenderness that I should know about. Okay, so say 99.
99. 99. 99. 99.
Okay. Again, for this, I will also percuss to make sure that there is no dullness. Okay, and once again, I'm going to listen.
Okay.
Okay, again, your lungs sounds were clear bilaterally, no wheezing and no crackles. So that is very good. So what I want you to do, I'm going to check some range of motion of your
Okay.
upper extremities, okay? Can you put your arms out? Can you rotate? Okay, can you rotate the other way? Okay, can you raise them up? And obviously you can put them down. Okay, good job. I'm going to check your radial and your brachial pulse, okay?
Okay.
Do this one and okay. I'm going to, before we move on, check your capillary refill. I know I've already looked at your hands. We want to make sure that it is less than 3 seconds, and it is. Okay. For this, typically we would assess your breast. We just would make sure that there are no lumps, that there's no discharge from your nipples. And also, do you perform self-breast exams?
Yes.
Okay, so I'll just tell you a little bit about it. What you would do is, start in the middle at your nipple and move in a circular motion, even up under your arms, to make sure that those lymph nodes have no lumps as well. Okay. Let's see. I'm gonna assess your kind of go back to your neck for a second. I'm gonna check your carotid arteries. Okay.
Okay.
So lift your head. I'm just gonna palpate one at a time. Okay, and I'm going to listen. Okay, there are not bounding. They are no. There's no brutes, no thrills. So I will. Let's go ahead and assess. We'll listen to your heart. Okay.
Okay.
You do not experience any chest pain or anything like that. Okay. So I'm gonna go ahead and listen to your heart. Okay. Okay. Your S1 and 2 are not diminished. I do not hear a murmur. So next, I want you to lay across the bed, and
Okay.
I'm going to examine your abdomen.
Okay.
Okay. For this purpose, also, I will not lift your shirt.
Okay.
But your belly is, obvious. It's flat. Do you have any tenderness
No.
at all? Okay. So I'm gonna listen to your bowel sounds. Okay. Okay, so your bowel sounds are normal. They're normal active. Again, you said you have had no pain, correct?
Correct.
So I'm gonna palpate your belly just slightly. Not to press very hard. Did any of that bother you? Okay, this time I'm gonna go a little bit deeper.
Okay.
Okay. Does that? Okay. Okay. While you're laying, I'm going to percuss your
Okay.
belly. Okay. Okay. Let's see. I'm going to try to palpate your liver. Okay. Okay. I'm not able to palpate. For again, while we're laying here, I will not do this, but I would check your inguinal pulse, and make sure that also the lymph nodes around in that area are not swollen. So if I was doing this to my patient, I would check right here. Also for the femoral pulse, I would go just a little lower and check, okay? But again, for this purpose, I will not do that. Okay, if you could, you can sit up.
Thank you.
Okay, so I'm gonna just take a look at your legs.
Okay.
They appear to be symmetric. You don't have any joint pain, or anything like that, correct? Okay, so I'm gonna look at your feet. I would look, at your skin. Again, it's dry, warm, not, there are no bruises, no lesions, no sores. I would check your cavity feel from your toes. Again, less than 3 seconds. Your legs both look symmetrical. While we're doing this, let me see, I'm going to check your pulses. So sometimes the popliteal is hard to find. Okay, and actually, again, it is present, not bounding. Okay, I'm gonna check your dorsalis, pedis, and your tibial. Okay. I want you to let's stand up.
Okay.
Okay. Can you pick pick one leg up and then the other? Okay. Can you make a circular motion
Yes.
with both legs? Okay, and then the other one. Okay, good job. All right, you can have a seat again.
Okay.
I want you to, I think, we can see. Okay. Can you push against my?
Yes.
Okay. Can you pull my hand?
Yes.
Okay, there. Very good. Okay, so I'm gonna check a few sensations.
Okay.
I want you to just tell me if you can feel what I'm doing. Okay. Okay. See your hands.
Yes.
Okay, and I'm just very lightly touching. Okay, you're at the bottom of your foot. Okay. 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 So I want you to close your eyes.
Okay.
I'm going to check something called your stereogenesis. I just want you. I'm going to put something in your hand, and I want you to tell me what it is. Okay.
Okay.
Okay. Close.
A coin.
Okay.
Something
Very
round.
Yes. Very good. Okay, so a few cerebral functions. Okay, I want you to take your finger.
Okay.
And look straight ahead and take your finger out and put it to your nose. Okay, Very good. And then I want you to take your heel
Okay.
of your right foot
Okay.
and rub it along your shin of the left, okay? Okay, very good. And do it with the other. Okay, very good. So we're going to do something that's called rapid alternate movement. So I want you to put your hands flat on your legs, okay? And very quickly turn them up. There you go. Very good. Okay, so I'm going to check a few reflexes, okay? So I do not have the equipment for this, so we're just going to, and I would do this bilaterally also.
Okay.
So I would check your bicep, and so what would happen is I would tap it and you would
Okay.
flex, okay? So your biceps, your triceps, your brachiocorsalis, your quadricep would be, so you know, you hit it, your leg would expand, okay? And also your Achilles, okay? So again, when you walked in the room, we're going to talk a little bit about muscle. When you walked in the room, you walked without incidents. You did not fall. You had no issues walking. Let's see. I'm gonna get you to do a few things. Can you stand up for me?
Yes.
Can you touch your toes?
Yes.
Okay. Okay. Can you walk heel to toe? So in a straight line, heel to toe.
Yes.
Okay. And you can come back. And can you walk on your tiptoes? Okay, very good. Let's see, we can touch your toe. Can you slightly bend your knees and hold it? So we're a little bit. Okay,
Yes.
very good. And let's see, we're able to touch our toes. So I'm gonna get you. It's called check your Romberg sign.
Okay.
So I'm gonna get you to stand with your feet together.
Okay.
And we're gonna close our eyes. Okay. So you can open. So that is negative. You, if it was positive, you would probably fall.
Okay.
And then I'm gonna check the range of motion of your spine. Okay. So I just want you to rotate. Okay. Okay. Very good. Are you able to bend backwards and bend slightly forward? Okay. Very good. Well, that actually completes our assessment. Thank you very much for allowing me to use you as my patient today.
Thank you.
Thank
You're
you.
welcome.